Hey guys, it's Miss Reyes and Miss Ratcliffe, and we're going to be going over the sterile glove skill with you guys today. So the very first thing that you want to do with this skill is you want to perform thorough hand hygiene and then place the glove package near your work area.
So make sure that you're getting a sterile package of gloves and make sure you know what your gloves are made out of. So these are not latex, but if you're really using latex, you would need to make sure your patient is not allergic. And also, I previously removed my jacket, so I'm not having any clothing potentially contaminated.
Okay, so you're going to remove the outer glove package wrapper by carefully separating and peeling apart the sides.
At this point, I like to rough my gloves up a little bit. It's going to help your package from not flapping back on you.
Okay, you're going to grasp the inner package and lay on clean, dry, flat surface at waist level. You're going to open the package, keeping gloves on inside surface of the wrapper.
Okay, I want y'all to notice that at this point, I do have an area. The center here is not, this is the sterile area, so you wouldn't want to put your hand over it or anything like that, okay?
Okay, so you're going to open the inner glove package using care, touching outer 1-inch borders of the packaging. You're going to identify the right and left glove, and then glove with the dominant hand first. So okay. She's touching that 1-inch border.
Yes, and at this point, I'm going to be very intentional with what I touch because I want to be very careful. And I'm also really making sure my package is laying flat. Okay, so I see both of my gloves. I've identified which glove I'm going to grab next.
She's going to grab the dominant hand first, the glove, the dominant hand first. So with the thumb and the first 2 fingers of the non-dominant hand, grasp the glove for dominant hand by touching only the inside surface.
Okay, and we're grabbing this cuff area that's actually going to be touching my skin. So this is what you've got to grab the cuff, okay?
Okay, she's going to lift the glove about 12 inches off of the sterile wrapper, and she's going to hold it with her fingers down and above the waist. She's going to take a step back, maintaining sterile technique. And then she's going to carefully pull the glove over her dominant hand, leaving a cuff and being sure that the cuff does not roll up the wrist.
Okay, I want y'all to remember not to let go here until you fully get your glove on, okay? So really pull it on, okay? Once you let go of this, you cannot come back up here and touch this. So make sure your glove is really on all the way.
Okay, so with the gloved dominant hand, she's going to slip the fingers underneath the cuff of the second glove and then hold the gloved thumb outward.
Okay, so at this point, I'm going to be very careful not to push my glove off to that 1 inch, because if I do, then it will be contaminated. I also am going to put my fingers deep into this cuff and have them all the way in, so I have leverage. Okay.
She's going to carefully pull the second glove over her non-dominant hand. After the second glove is on, she's going to interlock her hands together above waist level. Be sure to touch only the sterile fields.
Okay, so I've also stepped back for this one. When I'm putting that second glove in, I am hitchhiking that thumb up so I don't contaminate. And again, I am going to force with this dominant hand, I'm pushing in here. And I'm not gonna let go until my glove is fully on. Lock my hands together, make sure everything's good. At this point, my gloves are sterile. I can only touch sterile things. So I like to call this surgeon hands. I keep my hands up above my waist, away from my body. Okay, you don't want to do this because you can contaminate. And you also don't want to drop your hands below your waist because that's considered contaminating. So up and out, surgeon hands, okay?
And so what if you needed to take that package off of your table? How would you do that?
So right now, I have not contaminated my package, okay? So I can touch this. This is sterile. So I can touch the center here, and I can put it in the trash or on the floor.
Okay. Okay, so now she's going to do the removing of the sterile gloves. She's going to grasp the palm with her other gloved hand and avoid touching any part of her skin. She's going to pull the glove off, turning it inside out, and place it in the other gloved hand. She's going to take her fingers of her bare hand and tuck it inside the remaining glove cuff, and she's going to peel the glove off inside out and over the previously removed glove. And then she's going to discard both gloves and the receptacle. She's going to perform thorough hand hygiene. And for a moment, I want you guys to look at Miss Ratcliffe. Her hair is pulled back. She is in professional dress. So when you guys come into skills checkoff, we need to make sure that you are in your professional dress. That includes the hair, jewelry, uniform, lab coat, name badge, proper shoes, nails, anything like that, and your nursing supplies like your stethoscope. Okay, thank you.